Well, as a painter, being on your feet and on your legs is a very important part. You're always backing up, walking forward. You'd think you would sit for the most part in paint, but you don't. You stand. And this has been able, and I can see the future is going to be able to give me greater length times in my painting and more stability in my paintings. So I'm looking forward to getting out and doing some really good creations.
Go ahead, my lap. First, put it all the way flat. Good. Lift your legs straight up. Good. Let it bend now. Good.
Yeah, I'll just get carried away.
So it's been about 5 weeks.
I guess.
Good. So you have an incision. Straighten your leg out. Incision from there to there, so about 5-inch incision or so. Good. Do you have any pain?
I tell you, at night what I have is muscle spasms in my leg, and that keeps me.
So your leg goes straight now and down as well.
I guess the pain had been there so long that I tend to ignore a lot of it. I'd go and take ibuprofen or whatever. In my occupation, I would do a lot of trade shows, incentive travel. I was on my feet a lot. So it's one of those things you started to learn to live with. And so it had been going on for years. Decision maker, I guess, became between a life issue of putting health off long enough. It's easy to procrastinate, and I thought at first probably, it's some little something in your knee to go get orthoscopic surgery and have done with it or whatever. But it was just a personal decision of taking care of my health and looking toward the future. I had heard about St. Vincent's, and initially I went to see Dr. Barnes, who was recommended by another surgeon. And at that time, he was telling me about the St. Vincent's Academy and what they do, and the Joint Academy is what they had, which I thought was pretty unique. And so that's how I found out. I called them and got on their list for their classes.
Using the arms of the chair. That's how you can. You can do it from you can go down. You can do it from there. A little bit more. That's great.
There is a lot to knee replacement, but I think the Academy wants to inform you and better train you before surgery of what to expect. Here's the first week, here's the second week, here's what's going to happen. And that really helped a lot. That knowing that if I was going through a certain situation or whatever, that this is what's to be expected. Recovery process, first of all, the surgery. The surgery was quick and it was easy as far as surgeries go. It was painless, easy. I was in and out quick. The next day, they got me on my feet, and it's scary for the first time. You think, I've been on my feet all my life, but now they're asking me to be on my feet. I was in that afternoon, the day after surgery, post-op, I was in physical therapy. We started it. They kept me out of pain. The process was great. The folks at St. Vincent's know what they're doing and attended to me very well. I was there, I think, 3 days, and then I got to go home. From there, it took about, I would say, 3.5 weeks. During that time, I was on a walker, but I was mobile. And pretty much during the day, you get to know every TV channel that's on, and you get to watch everything, because that's just what you do in the recovery. And you have to know that you need to be still. You need to take time off in your mind. You need to take time off from work. And I'm just going to recover. After 3 weeks, I was off blood thinners. And then I started taking just over-the-counter medication. And pain was you know, at minimal or whatever. And so you see yourself after 4 weeks recovering very quickly after the surgery. So it was a growing process.
Let's see you walk. That's great. Okay.
Surprisingly, my new knee after 5 weeks feels stronger than my old knee, which I've had 56 years and I have no problem with. But it does, it feels stronger, and I almost feel more stable on the new knee than I do my regular knee. And I can do some chorus line too. Now I gotta take a nap. All right.
It's amazing. You look great.